Joining us in the studio for this week's Your Health segment are Greg Pirovolidis and Stefanie Ryan, both physical therapists with the University of Maryland Rehabilitation and Orthopaedic Institute. Thanks to both of you for being with us.
Thank you.
We want to talk about falls, which are incredibly common for people over age 65. Something like 1 in 3 have an incident every year.
Correct.
That's the statistic. Hard to believe, but true. It's one of the facts of as we age, we have more chance of falling just due to some of the normal aging processes.
What kinds of injuries, Stefanie, can result from a fall?
Commonly, we see fractures. Hip fractures are probably the one that people are most fearful of. Fractures in the spine, legs, sometimes a hand if you're going to prevent a fall using your hand to stop yourself, and brain injuries as well, traumatic brain injuries.
Why do we see so many falls? I mean, what happens in an older person to make that more likely, or do younger people trip and fall down too and just less likely to be injured?
Younger people do trip and fall, but it's definitely more common in the elderly. I think predominantly due to just a lot of the changes that happen with normal aging. For instance, after a certain age, about 45 is about the age where your strength peaks, you get weaker. And the factor that we try to change is the sedentary lifestyles we see of some of these patients, because if they're inactive, they don't exercise, their muscles get weaker, they're increasing their chances of falling.
It's really a use it or lose it kind of situation.
That's exactly the term we use with our patients.
What about your sense of balance and whether that's impacted either directly by aging or indirectly by maybe you're taking some medications?
Oh, absolutely. Balance is affected by your strength, your hip strength, your ankle strength, your knee strength. So like Greg said, that's all going to factor into it. Certainly, medications play a role. As we age, we see people who are on more hypertensive medications, cardiac medications, blood pressure, diabetes problems. And these people, especially if they're on 4 or more medications, are at a higher risk too.
Are there any that are especially problematic, or it's the combination?
Combination, as well as the new onset of those medications. So sometimes people are used to being on those medications and they may not be considered at higher risk. It's those first 2 weeks that they start medications that they're at higher risk. Interesting.
I was also wondering if age, chronological age is the right way to look at it. I'm sure we use 65 because that's a frequent cutoff point, but there's probably people who are 66, 67, 75 who don't have to worry about it.
You're absolutely right on that account. It's amazing. You can see people, and in my job when they come in, I look at their date of birth and you kind of try to figure this out, and some people can really fool you. It's those people who remain active and that are much younger than what their stated age is. And so what we stress in therapy and just in general, the fountain of youth is exercise. I always tell people if I could take a pill and have a pharmaceutical company make a pill that says exercise, be a blockbuster drug.
I should write that down. I don't think I've ever heard that said that simply, that the fountain of youth is exercise.
That's what I feel.
And you're not talking necessarily about running marathons.
No, not at all. A lot of it's stay active. I mean, for instance, playing ping pong, one simple thing. A lot of senior centers have ping pong tables. Well, it's amazing what that can do for you. It exercises your brain, your body. It keeps you loose and limber. It's just an excellent way to stay young.
Let's take a phone call. This is Jack in Harford County. Jack, thank you for calling. Go ahead.
Yes, I'm 45 years of age, disabled with my previous broken back and neck in 1974.
Oh, my.
Very, very active all my life, and lately I have been cut down by some form of arthritis. I am tripping and falling all over the place, and the pain is just spreading through every joint. They keep telling me it's osteo, and we've had a marker test on rheumatoid. Can you help me in any way or direct me to where I can, or what I should be examined for to figure out why all the pain in every single joint.
Jack, good luck to you. We'll get you an answer on the air.
That's specific questions like that are really hard to answer. It does need medical workup, and your healthcare provider is the place to start with that. It sounds like Jack has done some of that, but starting with the primary care provider and then looking at the different systems and having him or he or she direct that medical care is best.
We didn't talk, though, broadly about arthritis as a cause of some of these injuries or a reason that people might be slowing down.
It definitely is a factor. Sometimes I see a patient come in with arthritis in their knee, and when I'll check, say, their flexibility of their knee, and I'll notice, well, heck, their knee cannot straighten out, it can't fully bend. Well, that certainly can impact their ability to function daily and can increase their chance of falling.
So as physical therapists, what can you do to help people get more active, improve their balance, and get in a position to either avoid falls or handle them better?
Absolutely. When patients are referred by their healthcare practitioner, we'll go ahead and start with a full physical examination. That includes looking at their strength, looking at all of their joints, finding those muscles that might be too short, too weak, why they may be having some impaired balance, and provide those standardized tests to then really figure out, well, where do I need to train, and be specific with their exercise programs.
What's it mean that a muscle might be too short?
Inflexible. So Greg pointed out a good example is somebody's knee who may be just a little bit bent. That really does cause instability and increase their risk of falls. And maybe it's as simple as, boy, they just need to stretch their hamstrings.
How do insurance companies feel about this when you put in for reimbursement for this sort of workup or for therapy to strengthen those muscles?
We have to, after we evaluate the patient, we really determine what their deficits are. It could be a strength issue, a balance issue. There's multiple factors, and it can be very complex. And once we determine that, we can develop a plan on how we want to address their deficits and how we feel we can make them better. And it's kind of like we're showing the insurance company that we can make a difference. If I do see a patient, I might see a patient and just give them a home exercise program, say you need to do X, Y, and Z, and if you have any problems, please call me and I'll be glad to help you. So it varies between how complex the problem is as to how much care we will render. And generally, insurance does cover this because we can back it up. We use some standardized tests that can show exactly what we're doing.
Lastly, is there a role here for family members, maybe younger family members, to help somebody get moving?
Absolutely. So it's not even, yes, it is a matter of helping them get moving, maybe assisting in getting them up and out walking, because like Greg said, being a couch potato will create or increase these problems.
That's a good place to leave it. And we're out of time. That's Stefanie Ryan and Greg Pirovolidis of the University of Maryland Rehabilitation and Orthopaedic Institute. Thanks to both of you for being here.
Thank you.
Your health segments are a co-production of Maryland Public Television and the University of Maryland Medical System.